Taking care of your appearance is often misunderstood as vanity, but in psychology it's something very different. It's one of the simplest ways we communicate self-respect to ourselves first, and then to the world. When we talk about taking care of our appearance, it's easy to assume we're talking about looking attractive or meeting some external standard. But from a psychological point of view, self-respect has very little to do with perfection or approval. It's about the relationship you have with yourself, especially when no one else is watching. The way you care for your appearance is one of the most visible expressions of that relationship. It reflects how worthy you believe you are of time, effort, and kindness. Self-respect isn't built through grand gestures. It develops through repeated, ordinary decisions that say, I am worth looking after. Brushing your hair, wearing clean clothes, or choosing something that feels comfortable and intentional are not acts of vanity. They are signals you send to your own nervous system that you are deserving of care. Over time, these signals shape how you feel about yourself far more than motivational thoughts ever could. Perfection, on the other hand, often comes from fear. It's driven by the idea that you must look a certain way to be accepted or valued. That pressure tends to increase anxiety and self-criticism, not self-respect. When appearance becomes about flawlessness, it turns into another way to punish yourself for not being enough. Self-respect works in the opposite direction. It accepts that you are human, limited, and imperfect, and still chooses care rather than neglect. On difficult days, this difference becomes especially clear. When you're exhausted, overwhelmed, or low in mood, the urge is often to withdraw and stop caring for yourself altogether. This is understandable, but it can quietly reinforce the belief that you're not worth the effort when things are hard. Choosing small acts of care in these moments isn't about forcing positivity, it's about maintaining dignity. It's saying, even today, I won't abandon myself. Your appearance is one of the few things you interact with directly every day. When you consistently treat it with disregard, your mind takes note. Not consciously, but emotionally. Over time, neglect can become part of an internal narrative that says, I don't matter enough. Self-respect gently interrupts that narrative. It doesn't demand change overnight. It asks for consistency, not intensity. This is why self-respect through appearance should feel supportive, not demanding. It's not about following trends or spending money you don't have. It's about intention, choosing clothes that fit your body as it is now, keeping yourself clean and comfortable, making choices that reduce friction in your day rather than increase it. These actions are practical, grounded, and stabilizing, especially when life feels uncertain. Importantly, self-respect allows flexibility. Some days, caring for your appearance might mean getting dressed and feeling put together. Other days, it might mean rest, softness, and not pushing yourself beyond capacity. Respect is responsive. It listens to what you need, rather than imposing rigid rules. When appearance is framed this way, it becomes less about how others see you and more about how you treat yourself. You stop using it as a measure of worth and start using it as a form of care. Over time, this builds a quieter, more stable sense of confidence. Not the kind that relies on compliments, but the kind that comes from knowing you show up for yourself in small, reliable ways. The human brain is constantly scanning for signals of safety, threat, and stability. Much of this happens outside of conscious awareness. When you make small, visible efforts in how you care for your appearance, your brain doesn't interpret them as cosmetic choices. It reads them as evidence. Evidence that things are under control, that you are coping, and that your environment is predictable enough to manage. This is why even minor acts of grooming or dressing with intention can have a noticeable impact on how you feel. Our brains rely heavily on patterns to make sense of the world. When life feels chaotic or overwhelming, those patterns begin to break down, and the nervous system moves toward a state of alert or shutdown. Small routines linked to appearance, getting dressed in the morning, washing your face, brushing your hair, create reliable signals that anchor the day. They tell the brain that there is still structure present, even if other areas of life feel uncertain. This effect is closely tied to the concept of embodiment. The brain and body are not separate systems, sending instructions one way. They are in constant conversation. When the body is cared for, the brain often follows. Clean clothes, physical comfort, and a sense of order on the body can reduce background stress levels. This doesn't eliminate emotional pain, but it can lower the volume enough to make it more manageable. Visible effort also influences self-perception. The brain forms beliefs not only from thoughts but from behavior. When you act as someone who takes care of themselves, even in small ways, your brain updates its assessment of who you are. It starts to see you as capable, intentional, and worth investing in. This can gently increase motivation, not through pressure, but through alignment between action and identity. Mood disorders often disrupt this process. Low mood can reduce energy, and reduced energy leads to less visible effort. The brain then reads this lack of effort as confirmation that things are not going well, which can further lower mood. Small changes in appearance can interrupt this cycle. They act as a form of behavioral feedback, offering the brain new data to work with. Data that suggests you are still engaging, still participating, still present. Importantly, this isn't about pretending everything is fine. It's about giving the brain cues that support regulation. Just as slowing your breathing can calm the nervous system, so can reducing physical disarray. Comfort, cleanliness, and simplicity in appearance remove unnecessary stressors. They make it easier for the brain to allocate energy toward problem solving rather than survival. This is why people often report feeling slightly better after getting ready, even if their circumstances haven't changed. The improvement isn't imaginary, it's physiological. The brain responds to order and care because they historically signaled safety. In evolutionary terms, a body that is maintained is a body that is likely in a stable environment. The key is to keep these efforts small and achievable. When visible effort becomes overwhelming or perfectionistic, it can backfire and increase stress. The brain benefits most from consistency, not intensity. Repeating simple acts of care trains the nervous system to expect stability. Over time, this can support emotional resilience by creating a baseline of regulation that you can return to, even when life feels heavy. By understanding that your brain responds to what you do as much as what you think, appearance shifts from being superficial to being functional. It becomes a quiet tool for emotional support, grounded in biology rather than belief. When someone begins to neglect their appearance, it's tempting to label it as laziness or a lack of discipline. But psychologically, this is rarely an accurate explanation. In many cases, neglect is a signal that a person's emotional capacity is under strain. When the mind is overloaded, the brain starts prioritizing survival over maintenance. Tasks that once felt automatic begin to feel heavy, optional, or even impossible. Emotional overload can come from many sources. Chronic stress, anxiety, low mood, grief, burnout, or prolonged uncertainty all consume cognitive and emotional resources. The brain has a limited amount of energy available for decision-making and self-regulation. When that energy is depleted, non-urgent tasks are the first to be dropped. Appearance-related care often falls into this category, not because it lacks value, but because it requires initiation, sequencing, and follow-through. Neglect, then, is not a character flaw, it's a symptom. It reflects a nervous system that is stretched too thin. When someone stops caring for their appearance, it may be the most visible sign that something deeper is happening internally. This is especially important to recognize because people often judge themselves harshly for these changes, which can increase shame and further reduce motivation. The problem is that neglect can quietly reinforce emotional difficulties. When care for appearance decreases, the environment around the body becomes more chaotic or uncomfortable. The brain interprets this as further evidence that things are not going well. This creates a feedback loop where emotional overload leads to neglect, and neglect deepens emotional distress. Over time, this loop can become self-sustaining. This is where reframing appearance-related care as early intervention becomes useful. Rather than seeing grooming or dressing as something you do only when you feel good, it can be understood as something that helps prevent further decline. Small acts of care can slow the spiral before it gains momentum. They don't solve the underlying problem, but they can reduce the weight of it. Importantly, early intervention does not mean forcing yourself to perform at a high level. It means responding to neglect with curiosity rather than criticism. Asking what your system might be needing, instead of demanding more from it. Sometimes care might look like simplifying routines rather than adding to them, choosing comfort over presentation, removing barriers that make care feel overwhelming. Neglect also serves as information. It can alert you to the fact that your emotional load may need attention. Just as physical pain signals injury, neglect can signal emotional depletion. Paying attention to these signs allows for earlier support, whether that means rest, boundaries, connection, or professional help. When appearance is treated as a diagnostic cue rather than a moral failing, it becomes easier to respond with compassion. Compassion reduces shame, and reduced shame increases the likelihood of re-engagement. This shift alone can change the trajectory of someone's mental state. Feeling understood, even by yourself, creates space for recovery. Small, gentle acts of care can reintroduce a sense of agency during periods of overload. They remind the brain that not everything is out of control, that you still have influence over your immediate environment. This can be stabilizing, particularly when larger problems feel unmanageable. Recognizing neglect as a signal rather than a failure allows appearance-related care to become part of emotional regulation. It becomes a way of listening to yourself, responding early, and preventing deeper withdrawal. Over time, this perspective supports a more sustainable relationship with self-care, one that adapts to capacity instead of demanding performance. Self-trust is built through experience, not intention. It develops when your actions consistently match your needs, especially in small, ordinary moments. When you take care of your appearance in simple, repeatable ways, you create evidence that you will show up for yourself. Over time, this evidence becomes the foundation of self-trust. It's not dramatic, and it doesn't happen overnight, but it is reliable. Many people assume self-trust comes from confidence or motivation. In reality, it comes from follow-through. Each time you choose to meet a basic need, clean clothes, comfort, personal hygiene, you reinforce the idea that you are dependable. These actions don't need to feel inspiring to be effective. Their power lies in their consistency. The brain learns through repetition, not intensity. When life becomes difficult, people often stop trusting themselves. They may notice a pattern of avoidance, neglect, or self-criticism, and conclude that they are unreliable. This belief can be deeply destabilizing. Caring for your appearance in small ways can help counter this belief. It provides opportunities to keep promises to yourself that are realistic and achievable, even on hard days. Self-trust is particularly important during periods of stress or low mood, because it supports emotional regulation. When you believe you can rely on yourself, your nervous system settles. There is less internal conflict and less self-monitoring. Appearance-related care can contribute to this by creating predictable routines that reduce decision fatigue. You don't have to negotiate with yourself each time. You simply follow through. These routines don't need to be rigid. In fact, flexibility is essential for trust. Trust grows when your expectations match your capacity. On high-energy days, care might be more involved. On low-energy days, it might be minimal. What matters is that the care is intentional and responsive, not all or nothing. This teaches the brain that you will adapt rather than abandon yourself. When self-trust is weak, people often look outside themselves for reassurance. They rely on approval, validation, or structure provided by others. While external support can be helpful, over-reliance can increase anxiety. Building self-trust through daily acts of care strengthens internal stability. It reminds you that you have some control over how you experience your day, regardless of external circumstances. Appearance-related care is especially effective because it is visible and immediate. You can see the result of your effort right away. This clarity reinforces the connection between action and outcome. The brain registers this as competence. Over time, these experiences accumulate and reshape how you view yourself. Not as someone who only functions when things are easy, but as someone who can maintain care even when things are hard. Importantly, this process is not about discipline in the traditional sense. It's about reliability. Discipline often relies on pressure and self-criticism, which can erode trust. Reliability relies on kindness and realism. It's about choosing actions that are sustainable, rather than impressive. This distinction is crucial for long-term change. As self-trust strengthens, it begins to influence other areas of life. Decision-making becomes clearer, boundaries become easier to maintain. You're more likely to attempt challenges because you trust yourself to cope with the outcome. These shifts don't come from thinking differently about yourself, but from repeatedly acting in ways that confirm you are worth caring for. By grounding self-trust in everyday behavior rather than self-judgment, appearance-related care becomes a quiet but powerful psychological tool. It supports stability, resilience, and a sense of inner reliability that doesn't depend on mood or external validation. The way you treat yourself creates a reference point for how you expect to be treated by others. This happens subtly and often without conscious awareness. When you consistently care for your appearance, you communicate to yourself that you are worthy of respect and consideration. That internal message shapes your posture, your tone of voice, your boundaries, and the standards you tolerate in relationships. Self-respect isn't something you declare, it's something you demonstrate through behavior. When you neglect yourself, the brain absorbs that information and adjusts expectations accordingly. You may find yourself accepting dismissive behavior, overextending to please others, or minimizing your own needs. This isn't because you lack insight, but because your internal baseline has shifted. Appearance-related care helps stabilize that baseline by reinforcing the idea that you matter. Other people respond to cues, not intentions. They pick up on how you carry yourself, how you occupy space, and how you treat your own body. These cues are influenced by your internal state, which is shaped by daily self-care. When you respect yourself, even in small ways, it often shows in your presence. This can influence how others engage with you, often without either party being fully aware of why. Importantly, this isn't about blaming individuals for how they are treated. Harmful behavior is always the responsibility of the person engaging in it. However, self-respect does play a role in how quickly we recognize disrespect and how willing we are to respond to it. When your baseline includes care and dignity, violations stand out more clearly. You are less likely to rationalize or normalize treatment that falls below that standard. Caring for your appearance can also support boundary setting. Boundaries are easier to maintain when you feel grounded in your own worth. Small acts of self-care can strengthen this grounding. They remind you that your needs are legitimate and that your comfort matters. This makes it easier to say no, to ask for space, or to remove yourself from situations that feel draining or unsafe. There is also a reciprocal effect. When others treat you with respect, it reinforces your sense of self-worth. When they don't, a strong internal baseline helps prevent internalization. You're less likely to assume the problem is you. Appearance-related care contributes to this resilience by providing consistent reminders of your value, independent of external feedback. In professional or social settings, self-respect often influences how you present yourself and how seriously you take your role. This can affect opportunities, communication, and collaboration. Again, this isn't about appearance standards or image management. It's about alignment. When your outer behavior reflects inner respect, interactions tend to be clearer and more balanced. It's also worth noting that self-respect doesn't require constant effort or presentation. It allows for rest, softness, and imperfection. The key is intention, choosing care when possible, and choosing rest when needed. This flexibility signals a secure sense of worth rather than a fragile one. Over time, these patterns shape relationships. People who respect themselves tend to attract or maintain connections that are more reciprocal. They're also more likely to disengage from relationships that are consistently depleting. Appearance-related care is not the cause of this shift, but it is one of the reinforcing behaviors that support it. By treating yourself with visible care, you create a standard that guides both your own behavior and your expectations of others. That standard becomes the quiet framework through which relationships are evaluated and maintained. When life feels heavy, the idea of self-improvement can feel overwhelming. Large goals, transformations, or routines that once felt manageable may suddenly seem out of reach. In these moments, it's easy to conclude that self-care must wait until you feel better, but psychologically, this is often when care matters most, and also when it needs to be simplest. Starting small is not a compromise. It's a strategy that respects the limits of your nervous system. When stress, anxiety, or low mood are present, the brain has reduced capacity for planning, decision-making, and sustained effort. Asking too much from yourself during these periods can increase feelings of failure and reinforce avoidance. Small actions, by contrast, are more likely to be completed, and completion is what supports momentum. Manageable acts of care, such as washing your face, changing into clean clothes, or brushing your hair, require minimal energy but offer immediate feedback. They introduce a sense of order and relief that the brain can register quickly. This feedback matters. It helps counter the feeling of being stuck by providing evidence that movement is still possible, even if it's limited. When people are struggling, they often underestimate the value of these small steps. They dismiss them as insignificant compared to the scale of what feels wrong. But the nervous system responds to regulation, not scale. A single act that reduces discomfort or increases predictability can be enough to slightly lower stress levels. Over time, these small reductions add up. There is also an important emotional component to starting small. Choosing an achievable action protects self-esteem. When goals are realistic, success becomes more likely, and success builds confidence. This is particularly important during periods of vulnerability, when confidence may already be fragile. Small acts of care create opportunities for success without pressure. Starting small also allows care to be flexible rather than rigid. On some days, care might mean doing the bare minimum. On others, it might mean doing a little more. This adaptability prevents self-care from becoming another source of stress. It teaches the brain that care is something you can adjust, not something you fail at. When life feels heavy, people often withdraw from their bodies. They become disconnected from physical sensations as a way to cope. Gentle appearance-related care can help restore that connection in a non-threatening way. Simple, repetitive actions can be grounding. They bring attention back to the present moment without demanding emotional processing. Importantly, starting small is not about lowering standards permanently, it's about meeting yourself where you are. When capacity increases, care can naturally expand. When capacity decreases, it can contract again. This responsiveness is what makes self-care sustainable over time. There is also dignity in small acts. Even when circumstances are difficult, choosing to care for yourself communicates that you still value yourself. That message can be stabilizing. It counters the narrative that struggle equals failure. It reinforces the idea that worth is not dependent on productivity or appearance, but on basic human need. By focusing on what is manageable rather than what is ideal, care becomes accessible during all seasons of life. Small actions maintain continuity. They prevent complete disengagement and keep the door open for recovery. Over time, this approach supports resilience by allowing care to exist alongside difficulty, rather than waiting for difficulty to pass. Taking care of your appearance is not about chasing perfection or meeting anyone else's expectations. It is about how you choose to relate to yourself, especially when life is demanding. The small, consistent ways you care for your body send powerful messages to your brain about worth, safety, and reliability. Over time, these messages shape how you feel, how you cope, and how you allow yourself to be treated. When care is gentle, flexible, and grounded in self-respect, it becomes a quiet form of psychological support, one that doesn't require motivation, confidence, or the right mood, just the decision to not abandon yourself.